Thanks so much, Patsy. And so I'm just going to really briefly talk about some of the things that I've been doing. So again, I'm Wendy Kraglund-Gauthier. I'm an adult literacy, adult education researcher, educator, and I've been working with Patsy behind the scenes a lot of times for about the past I guess 11 years is what we've kind of figured out here. So in between supporting the Atlantic Summer Institute, but very specifically with the Circle of Health. And I want to really focus on the Circle of Health today, just um, as as Brian and Terry and Denise and Anne and Melina have talked about, the idea that the circle is both a tool but also a process that may not be as explicit and upfront, but it just kind of twirling around in the back of minds. And one of the things that I've been supporting Patsy with pre-COVID was actually doing Circle of Health workshops online. So my background is in universal design, online learning, and how do we create and present learning activities that kind of get at the concerns that Anne had mentioned about feeling connected, getting to know people. And so excuse me, over the last number of years, we've been doing these online workshops. And just as an example, I just wanted to show some of the things that we've been doing in these online workshops. So, we talk about the tangibility of picking these things up and moving it around. And, and if you're fortunate enough to actually have a 3D model, which I always find is fun as well. But when we're in an online space, it makes it a little more difficult. So what we've done is we've used the tools that are available as a digital entry point into the Circle of Health. So for example, we use shared screens and breakout rooms and sticky notes, and we encourage folks to really engage with the content. And this is just one of the screens actually from the spring excuse me, the spring class from Wagon University, where we broke folks out into small groups. So of course, that whole idea of small group conversations, where you're having those safe spaces to have those dialogues, and to offer an opportunity for folks to really talk amongst themselves about not just what this thing is, but how it works, and how, and Terry, you mentioned how it connects very specifically to community. And, we do different iterations of those. But for example, we're talking about, how we move from talking about to envisioning what could be. So when we talk about the Circle of Health as a process, and of how it underlines decision making. So thinking about the circle as a tool. Now the colors here do not represent the colors in the wheel. They were just broken up by groups. So we actually use the Circle of Health as conversations about mobilizing upstream policy. So mobilizing, getting to the upstream as opposed to the downstream. And all of the conversations that we did were rooted in the concepts of the Circle of Health. So Denise, you may have encountered some of these very same processes in your online content as well. So thinking about how we keep this moving forward, now that we've gone beyond the concerns that folks have about engaging in an online space, and hopefully we're mostly on the other side of the worst effects of the pandemic, and we can still come together. But what the online space does is that it enables us to get a more diverse group of people together to talk about some of these ideas. And that's one of the things that I've noticed over the last decade of work, is that how this online space has given us this opportunity to talk and meet people who we never may have encountered before because of so many limitations of geography, winter travel, travel budgets, and time. So when we think of it as a process, that's where I really find it so interesting. You know, we have 6 cohorts in a German university that have gone through this. We used it as a process for active aging in seniors' homes in Ontario to move their active living processes forward. Online, you know, teaching trainers how to use these processes. So that's what's been very, very exciting for me. And, you know, the idea that the circle itself, it's a neutral tool. It doesn't prioritize one person's opinion over another. It helps bridge the understanding of common goals, and it helps get that idea of where those common goals come from and sees all the intersectionality of the impacts in our communities. So I'm going to stop there because I want to make sure that folks have an opportunity to chat more before we end off.